encourage that segment forward, and then we're gonna let it drop to recompress afterwards to like hold it in place. Does that kind of make sense?
Yeah.
So the way that would be applied is if I'm, can I go ahead and uncover just the top half of your leg? Cool. So we're going to pincer grasp. We are going to literally decompress, but you will notice that the flesh underneath your fingers moves. So you're gonna have to decompress, apply the distraction, and then load in. Nice breath in. As I'm decompressing, decompress first so she can relax. I will go ahead and load in sustained glide, maybe some oscillations with patient breathing. And when she breathes out, I'm going to maintain my pressure forward, let go of my decompression forces, and then let go of my correction. Yes?
How many times have you done?
As many times as necessary for the joint to feel like it's been improved. All right, so you may notice that doing just one round of pa-pa-pa-pa-pa might be enough, right? But you might go back and be like, oh, no, not quite. And then you have to go at it again. Totally normal, just checking with your patient, make sure they can tolerate you doing it again. Now, what I find to be a little bit more gentle, that is specifically using the pincer grasp. I'm a big fan of doing the broad hand contact, where same thing, you're just loading in and you're trying to, I'd say the J stroke is what I like to do. Instead of just pushing straight anterior on that SP, it's like an anterior with a lift. Now, the reason why I like the broad contact is because it's less pokey for the patient, but you don't want their SPs to compress over your carpal tunnel. Okay, because you don't want to damage yourself trying to help your patients. So what you can do is you can try and create a little bit of like a hollow in that area, and instead you're trying to actually apply pressure with these points here on either side instead of directly on the SP. Yes, Julia?
So, are you applying to a specific SP? Or
Correct.
is it broad?
Both. So the one you saw me doing the pincer grasp, that one was definitely segmentally. The broad hand contact one can be both. So you can pick a specific segment, but you can also like do a slight travel with it as well too to apply decompression and forward stroke. So you can utilize it however is most effective for you. Some people notice like a single segment, we really need to counter that challenge that one. Some people it's more like like a few segments, in which case broad contact influencing the entire spine in that area would be a good idea. The way I generally apply it is segmentally first and then broad is how I do it. Just to like even it out. Good question. Any other question about that technique? Okay, so if there's a hyperlordosis, work to decrease that hyperlordosis. If there's a hypolordosis, work to increase lordosis. And then depending on where you feel like the lack of muscle tone is, you'll be working to try and activate inflection. Okay, so she's going to be trying to posterior tilt. To try and encourage hollowing out. And then for home care, what type of exercises is she gonna focus on trying to do? The flexion exercises. Core ideally, but yeah, we want to focus on stabilizing. Yes. Okay, so primary things that you guys are going to practice. Practice different ways of addressing the structures in the chains that we're going to target. So into the glutes, possibly upper legs, into the low back, and up into the inferior axilla. So just assess all that tightness in the tissues, balance out the tightness in the tissues as best as you can, go in and address any of the joints that you have to, whether it's decreasing or increasing their lordosis. Decompress, 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 and then more soft tissue. Any questions about all that? Julia first and then Gigi.